अस्सलाम वालेकुम स्टूडेंट्स। तो आज से हम स्टार्ट करते हैं इन्फ्लेमेशन को। सबसे पहले इन्फ्लेमेशन है क्या? तो ये हमारे साथ एक प्रोटेक्टिव रिस्पॉन्स है जो कि एलिमिनेट करता है इनिशियल काज ऑफ द सेल एनजी को और इसी तरह नेक्रोटिक टिश्यू को भी। और दूसरा ये हमारे साथ हीलिंग ऑफ द टिश्यू भी करता है एंड रिकंस्ट्रक्शन ऑफ द साइट ऑफ द इंजरी भी करता है। और इसको हम डिफाइन करते हैं इज द रिस्पॉन्स shown by the vascularized connective tissue toward any injury is known as inflammation, and the response may be protective or it may be harmful in certain conditions. अब बात करते हैं about the advantages of the inflammation. तो inflammation causes the destruction of the invading microorganism. It also causes inactivation of the toxin. It may causes the healing and repair of the tissue. It also wall up the injured area to protect the other area from the effects of the inflammation. So hence the inflammation is a protective response. अब बात करते हैं about the disadvantages. So the inflammation may be harmful, like in encephalitis, which is the inflammation of the brain parenchyma that occur due to the viral infection, and it may cause the swelling of the brain and lead to the death. दूसरा हमारे साथ है autoimmune reaction, in which there are antibodies formed against its own tissue. The example include rheumatoid arthritis that involve inflammation of the joints and the formation of the antibodies against the joints. तीसरा हमारे साथ है hypersensitivity reaction, which is the poor response of the immune system to an antigen. And example include allergic rhinitis. If there is recurrent attack of the allergic rhinitis, it may lead to the formation of the polyps within the nose. अब बात करते हैं about the cardinal sign of the inflammation. So the inflammation contains the five main cardinal signs. The first four signs were discussed by the Celsius, and they include the redness, which is known as the rubor. Second one is the heat, which is known as the killer. The third one is the pain, which is known as dollar. And the fourth one is the swelling, which is known as the tumor. And the last one, which is the loss of function, also known as the punctalesia. And this sign was discovered by the VHU. So the cardinal sign include redness, heat, pain, swelling, and the punctalesia, which is the loss of function. अब बात करते हैं about the types of inflammation. So the inflammation may be acute or may be chronic. The acute inflammation is of the short duration, and the predominant cell in the acute inflammation are the neutrophils, which have the multilobular nucleus. And the chronic inflammation, which is of longer duration, and the cell involved in chronic inflammation are the lymphocytes, which have unilocular nucleus. अब हम बात करते हैं about के हमारे साथ inflammation होता किस तरह है। तो अगर कोई पान एजेंट आ जाए within the body, like it may be microbe or toxin. So first it is recognized by the antigen presenting cell of the body, and these antigen presenting cell may be the macrophages or may be the epidermal dendritic cell. And these antigen presenting cell recognize the antigen as a foreign agent, and they causes the release of various mediator substances. And these mediator acts upon the blood vessel and causes vascular changes and the cellular changes. And due to these changes, there is a recruitment of the leukocytes occur toward the site of the injury. And this leukocyte causes the phagocytosis and neutralization of the microbe. इसी तरह later on there is repairing and the scarring of the tissue occur. अब हम start करते हैं acute inflammation को. So acute inflammation is the immediate and early response shown by the vascularized connective tissue toward any injury or the invading microorganism, and it is the first line of defense against the injury. अब बात करते हैं about the characteristics. So the acute inflammation is acute or sudden onset, and it is of the shorter duration that lasting for a few minutes to a few days. In acute inflammation, there is formation of the exudate occur, which is a protein-rich fluid, and the predominant cell in the acute inflammation are the neutrophils, which have a multilobular nucleus. And the cardinal signs are present within the acute inflammation, which include the pain, swelling, redness, and the loss of function. And the systemic infestation of acute inflammation include the fever, which is of the higher grade. अब बात करते हैं about the causes of the acute inflammation. So the acute inflammation may occur because of invasion of the microorganisms, which include the bacteria, viruses, fungi, and the protozoa. That may also occur because of the mechanical trauma that include the crushing or the cutting injuries. And it may also occur because of the chemical injury that occur due to the poisons, toxins, corrosive acids, and the alkalis. It also involves the radiation therapy that include ionizing radiations and the UV light. Similarly, it may also occur due to the heat, excessive heat, and the cold, like excessive cold, which leads to the frostbite. इसी तरह The acute inflammation may also occur due to the immunological reactions that include the autoimmune reaction. The example include rheumatoid arthritis or the hypersensitivity reaction. अब हम बात करते हैं अबाउट द चेंजेस इन द एक्यूट इन्फ्लेमेशन। तो एक्यूट इन्फ्लेमेशन में हमारे साथ वास्कुलर चेंजेस भी होते हैं और सेलुलर चेंजेस भी होते हैं। द फर्स्ट वन इज द वास्कुलर चेंजेस that include the change in the caliber of the blood vessel, change in the blood flow, increase in the vascular permeability, and the fourth one is the exudation of the fluid. तो सबसे पहले आते हैं about the change in the caliber of the blood vessel. It initially involved the vasoconstriction of the blood vessel, followed by the persistent vasodilation. The vasoconstriction is the first change in the blood vessel, and it involves terminal arteriole, and it is transient in nature, means it is for a shorter duration, and the vasoconstriction occurs due to the local neuronal reflexes, and the vasoconstriction is then followed by the persistent vasodilation of the blood vessel, which remains for a longer time, and the vasodilation occurs due to the release of the inflammatory mediators that include the histamine and the bradykinin, and due to the vasodilation there is increase in the blood flow toward the site of the inflammation, which leads to the redness and heating of the area. इनिशियली जो ब्लड वेसल होता है वो कंस्ट्रिक्ट करता है, उसके बाद हमारे साथ वेसो डायलेट करता है, ठीक है। अब दोस्तों हमारे साथ है चेंजेस इन द ब्लड फ्लो। Initially, there is increase in the blood flow occur, and this increase in the blood flow is due to the dilation of the terminal arteriole. But this increase in the blood flow is for a shorter duration, and then it is followed by the stasis of the blood. In stasis, there is decrease in the velocity of the bloodstream occur, and this decrease in the velocity is due to the increase in the permeability of the blood vessel. And due to increase in the permeability, a large amount of the fluid in the protein they leak out from the blood vessel into the interstitium, and due to which the viscosity of the blood inside the blood vessel decreases. And due to the increase in the viscosity, there is decrease in the blood flow occur. अब तीसरा हमारे साथ है increase in the vascular permeability, which is the hallmark of the acute inflammation. And the vascular permeability that depends on the intercellular junction or the intercellular pore between the endothelial cell. In acute inflammation, there is increase in the vascular permeability occur. Let's suppose अगर ये हमारे साथ blood vessel है, if there is increase in the intercellular junction between the endothelial cell occur, then a large amount of the fluid and the protein molecule leak out from the blood vessel into the interstitium, and there is stasis of blood occur inside the blood vessel, and this protein rich fluid is known as the exudate, which leads to the swelling of the tissue. अब हम बात करते हैं about the mechanisms that are involved in the increased vascular permeability। तो उसमें सबसे पहले आ जाते हैं endothelial cell contraction that occur due to the actin filaments। दूसरा है the endothelial cell retraction that occur due to the reorganization of the cytoskeleton। तीसरा है the direct injury to the endothelium that involve necrosis of the endothelium, and it leads to the increased vascular permeability. चौथा है हमारे साथ the leakage from the newly formed capillaries. The new blood vessels that are formed during the process of healing, they are more leaky and they causes increased permeability of the blood vessel. पांचवा है हमारे साथ the leukocyte mediated endothelial cell injury. The activated leukocyte they release a proteolytic enzyme which causes the increased vascular permeability and damage to the endothelium. And छठा है हमारे साथ increased transcytosis, which also lead to the increased vascular permeability, and the transcytosis occur due to the vesicovacuolar organelles that are formed at the intercellular junction. And the increased vascular permeability involve the venules, so the venules are most commonly involved, and then followed by the capillaries and the terminal arteriole. अब आ जाते हैं about the patterns of the increased vascular permeability. So the pattern there depends upon the severity of the cell injury, and the responses may be the immediate responses or the delay responses. So the first one is the immediate transient response that occur in response to the mild injury. And immediate means that the permeability begins within 1 to 2 minutes, and transient means that it passes for a shorter duration by about 15 to 30 minutes. And the immediate transient response occurs due to the substances that are released from the preformed vesicle, like histamines and the bradykinin, and it includes the endothelial contraction. Those are the immediate prolonged response. So the immediate prolonged response occurs in response to the severe injury. Here the permeability increases suddenly and it is continued for a longer time, and it includes the endothelial cell necrosis. तीसरा हमारे साथ है the delay transient response. So delay means that the permeability increases slowly, but transient means that it remains for a shorter time. So it involves the endothelial cell retraction and it occurs in the bacterial infection. चौथा हमारे साथ है delay prolonged response that occur in response to the moderate NG and it involves the endothelial damage. And delay means that the permeability increases slowly but and prolonged means that it remains for a longer duration. And the example include the late sunburn. अब चौथा हमारे साथ है exudation of the fluid. जब blood vessel की permeability बढ़ जाती है, then the protein rich fluid leak out from the blood vessel into the interstitium and this protein rich fluid is known as the exudate. अब आ जाते हैं about the factors that control the transport of substances across the blood vessel. It include the post-Starling process. The first one is the capillary hydrostatic pressure, which pushes the fluid out of the blood vessel. दूसरा हमारे साथ है the capillary oncotic pressure. The oncotic pressure is due to the plasma protein. The capillary oncotic pressure holds the fluid inside the blood vessel. तीसरा interstitial osmotic pressure, which pulls the fluid out of blood vessel into the interstitium. And चौथा हमारे साथ है interstitial hydrostatic pressure, which pulls the fluid back into the blood vessel. नॉर्मली जो है ना आर्टीरियल साइड पे हमारे साथ हाइड्रोस्टैटिक प्रेशर ज़्यादा होता है तो फ्लूइड और प्रोटीन कंटेंट जो है ना दे लीक आउट ऑफ द blood vessel into the interstitium. लेकिन venous साइड पे हमारे साथ हाइड्रोस्टैटिक प्रेशर कम होता है. So these fluid and the protein molecule are pulled back into the blood vessel. But during the inflammation, the fluid exudation occur because of the increased hydrostatic pressure of the capillaries and the increase in the permeability of the capillaries, which causes a large amount of the fluid and the protein to leak out of the blood vessel into the interstitium and form the exudate. अब बात करते हैं about the effects produced by the exudate. So the exudate may have some advantages and the disadvantages also. The advantages include the exudate causes the dilution of the irritant substances and reduces its effects. Similarly, it also brings the immune cell toward the site of the infection and the leukocyte. They form the lactic acid, which decreases the pH and this acidic pH causes inhibition of the growth of the microbes. Similarly, the exudate also bring the fibrin molecule toward the site of the inflammation and the injury, which causes the walling of the inflamed area. The disadvantages include the exudate causes swelling of the site of the inflammation, lead to the edema, and it also causes increase in the tissue pressure, which causes pain. Similarly, exudate also causes the excess of the fibrin deposition, which may lead to the fibrosis of the area. अब बात करते हैं about the difference between the exudate and the transudate. Exudate is a characteristic of the acute inflammation, and it is formed as a result of the endothelial cell damage or the increase in the vascular permeability. Whereas transudate is the ultrafiltration of the plasma, and it is formed as a result of the increased hydrostatic pressure, and the permeability of the endothelium remain intact in the transudate. इसी तरह the exudate has a higher protein content and its specific gravity is greater than 1.016, whereas the transudate has a low protein content and its specific gravity is less than 1.016. इस तरह जो exudate होता है they may contain the RBC because of the increased permeability and the increased gap between the endothelial cell, but in transudate, no RBC are present. Similarly, in exudate, the coagulation occurs due to the presence of the fibrinogen, but in transudate, no coagulation occurs because of the lack of the fibrinogen molecule. In exudate, the LDH content is more than 200, whereas in transudate, the LDH content is less than 200. The example of the exudate include bacterial peritonitis, acute rhinitis, or the sinusitis, whereas the transudate examples include cirrhosis of the liver, renal failure, and the heart failure.